Basics of Medical Biochemistry. First edition, 2022. Chapter 5. Chemistry of Lipids. Part 2 of 2. By Professor Dr. Muhammad Jawad. MBBS, Dow, M. Philosophy, Ph.D., Dip M.E. Head of the Biochemistry Department-Fazaia Ruth Pfau Medical College-PAF Base Faisal-Karachi-Pakistan. Ex-Professor of Biochemistry, Qassim University Kingdom of Saudi Arabia. Ex-Professor, Head of the Biochemistry Department and Vice Principal. Liaquat College of Medicine and Dentistry and Fatima Jinnah. Dental College, Karachi, Pakistan. 5.4 Physical properties of neutral fats, triacylglycerol/triglycerides. Pure fats are colorless, tasteless, and odorless compounds. They can float on water, as their density is less than 1.0. Low molecular weight fats, particularly with short-chain unsaturated fatty acids, are liquid at room temperature called oils. Fats with long-chain saturated fatty acids have high values of melting points. Amphipathic nature of lipids, fats and oils including fatty acids, phospholipids, sphingolipids, bile salts and, to lesser extent cholesterol, are amphipathic molecules. They have two distinct ends, a water-loving or polar, hydrophilic, head and a water-fearing, hydrophobic, chain. All of the lipid molecules in cell membranes are amphipathic. The most abundant membrane lipids are phospholipids. They become oriented at oil-water interfaces with the polar group towards the water phase and the nonpolar group towards the oil phase. A bilayer of such amphipathic lipids is the basic structure in biologic membranes. Figure 5.21 Amphipathic behavior of lipids, source, slideshare.com. Liposomes. A liposome is a spherical vesicle having at least one lipid bilayer with an enclosed part of the aqueous medium. Liposomes can be prepared by disrupting biological membranes, such as by sonication. They are useful for stabilizing therapeutic compounds, overcoming obstacles to cellular and tissue uptake, and improving the biodistribution of compounds to target sites in vivo. Liposomes are of possible clinical use, particularly when combined with tissue-specific antibodies, as carriers of drugs in the circulation, targeted to specific organs, example in cancer therapy. The liposome can also be used as a vehicle for the administration of nutrients. In addition, they are used for gene transfer into vascular cells and as carriers for topical and transdermal delivery of drugs and cosmetics. Micelles. These are colloidal particles formed by aggregation of lipids in such a way that the polar region faces the outer surface of the micelle and the nonpolar region forms the central core. Micelles are useful because they allow a water-insoluble product or substance, for example, lipids or drugs, to be kept in solution by insertion into the core of the micelle. In the intestine, their main function is to transport free fatty acids and cholesterol up to the epithelial cell surface, thereby helping the small intestine to absorb essential lipids and fat-soluble vitamins. Figure 5.22 Amphipathic behavior of lipids in the membrane, liposome and micelles, source, slideshare.com. 5.5 Chemical properties of neutral fats, triacylglycerol/triglycerides. 1. Hydrolysis. Triglycerides are hydrolyzed to glycerol and 3 molecules of fatty acids. They are hydrolyzed by the enzyme, lipase, which is hydrolase in nature. In this reaction, triglyceride is sequentially hydrolyzed giving diacylglycerol, monoacylglycerol, and finally glycerol, and a fatty acid at each of 3 steps. The fats may also be hydrolyzed by superheated steam and acids, or alkalis. Figure 5.23 Hydrolysis of triglyceride. 2. Saponification. Triglycerides are hydrolyzed by alkali, sodium or potassium hydroxide. The process is known as saponification. The products of this reaction are glycerol and sodium or potassium salt of fatty acid called soap. Figure 5.24 Saponification reaction. Saponification number, the number of milligrams of alkali, NaOH or KOH, required to neutralize 1 gram of fat is called the saponification number. It is an indication of the molecular weight of fat. The higher the saponification number, the lesser will be the molecular weight of fat. The value is higher for fats containing short-chain fatty acids. Soap formed by this process is precipitated by salting it out with saturated sodium chloride. Table 5.6 Saponification number of some fats. Name of fat. Saponification number. Human fat. 194 to 198. Butter. 210 to 230. Coconut oil. 253 to 262. 3 addition reactions. Fat molecules can add a variety of substances due to the presence of double bonds of unsaturated fatty acids. Halogenation, it is the addition of halogens, fluorine, chlorine, etc., to the unsaturated fatty acids of fats. The order of halogenation is CLFBRI. Iodine number, the number of grams of iodine taken up by 100 grams of fat is termed as iodine number. It is an index of the degree of unsaturation of fat. The higher the iodine number, the higher will be the degree of unsaturation. Table 5.7 Iodine number of some fats and oils. Name of fat. Iodine number. Coconut oil. 6 to 10. Butter fat. 26 to 28. Beef fat. 35 to 42. Olive oil. 79 to 88. Corn oil. 102 to 130. Cottonseed oil. 103 to 111. Sunflower oil. 110 to 143. Lower is the iodine number, less is the degree of unsaturation. Determination of iodine number is helpful to know the degree of adulteration of a given oil. 2. Hydrogenation, the addition of H2 to the double bond of unsaturated fatty acid is called hydrogenation. Unsaturated fatty acids are made saturated by the process of hydrogenation. This reaction is widely exploited commercially for the production of solid fats from oils. A metallic catalyst like platinum, palladium, rhodium, or nickel is required for a hydrogenation reaction. 3. Oxidation, lipid peroxidation. In vivo lipid peroxidation is the oxidative degradation of lipids. In the living cells, lipids undergo oxidation to produce peroxides and free radicals which can damage the tissue. The free radicals are cytotoxic and believed to cause inflammatory diseases, aging, cancer, etc. Repeated cycles of lipid peroxidation can cause serious damage to cell membranes. Fortunately, cells possess defensive weaponry like antioxidants such as vitamin C, vitamin E, urate, and superoxide dismutase to prevent in vivo lipid peroxidation. 4. Rancidity, the appearance of unpleasant taste and smell due to the deterioration of fats and oils is called rancidity. Fats containing unsaturated fatty acids are more susceptible to rancidity. It occurs when fats and oils are exposed to air, moisture, light, bacteria, etc. Hydrolytic rancidity, it occurs due to partial hydrolysis of triacylglycerols by bacterial enzymes, lipase. Hydrolytic rancidity occurs when water splits fatty acid chains away from the glycerol backbone in glycerides. In the case of butter, some short-chain fatty acids are produced which give a rancid taste and odor to butter. 2. Oxidative rancidity, it is due to the oxidation of unsaturated fatty acids. This results in the formation of unpleasant products such as decarboxylic acids, aldehydes, ketones, etc. They are unsuitable for human consumption. Rancidity can be prevented by the addition of certain antioxidants like vitamin C, vitamin E, gallic and acid and alpha-naphthol to the food during commercial preparations. Butylated hydroxyanisole, E320, and butylated hydroxytoluene, E321, are synthetic antioxidants that work by stabilizing free radicals. 5.6 Steroids and sterols. These are the groups of naturally occurring substances having in common a steroid nucleus called perhydrocyclopentanophenonthrene. The steroid nucleus is a fused 4-ring core structure, 3 of them A, B and C rings are 6-membered while ring D is 5-membered. Carbon number 10 and 13 are occupied by the methyl group in most natural steroids. Figure 5.25 Structure of per-hydrocyclopentanophenonthrene, steroid, nucleus. Steroids are lipids because they are hydrophobic and insoluble in water, but they do not resemble lipids since they have a steroid nucleus. Steroids vary by the functional groups attached to these rings and the oxidation state of the rings. Hundreds of diverse steroids are found in plants, animals, and fungi. Sex hormones, hormones of the adrenal cortex and cardiac glycosides, all are steroids in nature. Sterols are a subgroup of steroids having one or more hydroxyl groups but they are without carboxyl groups. Cholesterol is the most common sterol kind of steroid and is the precursor of vitamin D, testosterone, estrogen, progesterone, aldosterone, cortisol, and bile salts. The plant equivalents of sterols are phytosterols, ergosterol, etc. 5.6.1 Cholesterol. It is the most important sterol in the human body. It is a 27-carbon compound with a steroidal nucleus, having the molecular formula C27H45O. It has an O group at C3, a double bond between C5 and C6, 2 CH3 groups at C10 and C13 and an 8-carbon side chain attached to C17. Figure 5.26 Structure of cholesterol. Some important features of cholesterol are mentioned below. Cholesterol is a waxy, fat-like substance required for the normal functioning of the body. It is widely distributed in all cells of the body but particularly in nervous tissue, muscles, skin, liver, intestines, and heart. The high content of cholesterol in the skin is related to vitamin D synthesis by ultraviolet rays and that in the adrenal gland and gonads to steroid hormone synthesis. It is a major constituent of the plasma membrane and lipoproteins. It is synthesized in many tissues from acetyl-CoA. It is a major constituent of gallstones, first isolated from gallstones in 1784. Normal values, for adults in fasting vary with age, sex, diet, and geographic or cultural region. Desirable level, 140-199 mg/dl. Borderline high, 200-239 mg/dl. High, greater than 240 mg/dl. Cholesterol level is maintained by exogenous, diet, and endogenous, de novo synthesis mainly in the liver, sources. Dietary cholesterol comes primarily from meat, poultry, fish, and dairy products. Cholesterol occurs both in free form and in ester form. In cholesteryl ester, the hydroxyl group in position 3 is esterified with a long-chain fatty acid. A total of free and cholesteryl ester in serum is called serum total cholesterol. Functions of cholesterol. It is an important sterol of the animal body, not found in plants. Being a bad conductor serves as insulating material in the body. It rapidly forms esters with fatty acids and helps in their transportation. It is the precursor of all other steroids in the body, including hormones of the adrenal cortex, sex hormones, bile acids, and vitamin D. It prevents excessive loss of water through the skin. Clinical aspect: higher amounts of cholesterol, hypercholesterolemia, can cause atherosclerosis of vital arteries, causing cerebrovascular, coronary and peripheral vascular disease by narrowing and hardening the arteries. 5.7 Terpene and isoprene unit. Multiple isoprene units containing hydrocarbons are called terpenes. Isoprene unit is 5 carbon atoms and 8 hydrogen atoms containing structure. At least 2 isoprene units are required to produce a terpene. A terpene has carbon and hydrogen in the ratio of 10:16. Structurally a terpene may be linear, cyclic, or both. Dolichol is a 17-21 isoprene unit containing alcohol. Other examples of terpene-containing compounds are vitamin A, E, K and coenzyme Q. Significant amounts of evidence suggested that terpenes have direct physiological effects on the body, especially for linalool and limonene. Linalool-rich strains are likely to have a calming effect and provide pain relief, while limonene-rich strains are likely to elevate mood. Figure 5.27 Structure of Isoprene Unit 5.8 Icosanoids. It is a group of biologically active substances derived from the following 320-carbon polyunsaturated fatty acids. 1,3 double bonds containing polyunsaturated fatty acid, dihomogammalinolenic acid, 20:3, 8,11,14. It belongs omega-6 family. 2 4 double bonds containing polyunsaturated fatty acid, arachidonic acid, 20:4, 5,8,11,14. It belongs to the omega-6 family. 3 5 double bonds containing polyunsaturated fatty acid, icosapentaenoic acid, 20:5, 5,8,11,14,17. It belongs to the omega-3 family. All these three polyunsaturated fatty acids are nutritionally non-essential, as these can be synthesized from linoleic acid, which is a perfect essential fatty acid. Most of the icosanoids are derived from arachidonic acid and are usually termed arachidonic acid metabolites. They possess the following characteristic features. Act as paracrine or autocrine messenger molecules. They have short half-lives, 10 seconds to 5 minutes, so functions are usually limited to actions on nearby cells. Bind to specific cell surface G protein-coupled receptors, and generally increase CAMP levels. May also bind to nuclear receptors and alter gene transcription. They are rapidly inactivated and excreted. They perform a wide variety of biochemical functions. Icosanoids are categorized into two subgroups, I-prostanoids, prostaglandins, prostacyclins, and thromboxanes, and 2. Leukotrienes and lipoxanes. 5.8.1 Prostaglandins, PGS. A group of icosanoids, derived mostly from arachidonic acid by the cyclooxygenase pathway. Structure of prostaglandins. The number of double bonds in the PG molecule is designated by a subscript so that, the following three series of PGS are created. 1. The series 1 of PGS has one double bond at position 13-14, example PGE1. 2. The series 2 of PGS has two double bonds at positions 5:6 and 13-14, example PGE2. 3. The series 3 of PGS has three double bonds at positions 5:6, 13-14, and 17-18, example PGE3. Figure 5.28 Structure of prostaglandins. The principal PG precursor in most species is arachidonic acid, liberated from phospholipid stores, principally by cytosolic phospholipase A2, which gives rise to series 2 of PGS. Series 1 of PGS is derived from homogammalinolenic acid and series 3 of PGS is derived from icosapentaenoic acid. Functions of prostaglandins. Prostaglandins are produced in almost all the tissues of the body. They act as local hormones. They are not stored and they are degraded to inactive products at the site of their production. PGS are produced in very small amounts and have short half-lives like other icosanoids. They perform a significant role in the following functions of the body. Regulation of blood pressure. The prostaglandins, PGE, PGA, and PGL2, are vasodilators in function. Their action results in increased blood flow and decreased peripheral resistance to lower blood pressure. They are used in the treatment of hypertension. 2. Inflammation. PGE1 and PGE2 induce the symptoms of inflammation, redness, swelling, edema, etc. due to arteriolar vasodilation. PGS are natural mediators of inflammatory reactions of rheumatoid arthritis, psoriasis, urticaria, conjunctivitis, etc. These inflammatory reactions are counteracted by corticosteroids since they inhibit prostaglandin synthesis. 3. Reproduction. PGE2 and PGF2 stimulate uterine contraction like oxytocin. They are used for the legal termination of pregnancy on medical grounds and induction of labor. For inflammatory and febrile responses, prostaglandins have a definite role in producing pain and fever. Fever-producing agents, pyrogens, promote prostaglandin synthesis, leading to the formation of PGE2 in the hypothalamus regarding the regulation of the body temperature. PGE2 along with histamine and bradykinin causes pain. Migraine is also due to PGE2. Aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, inhibit PGS synthesis to exhibit an antipyretic plus analgesic role and thus control fever and relieve pain. Regulation of gastric secretion. Prostaglandins play a significant role in maintaining the integrity of gastric mucosa. PGE inhibits gastric secretion. They are used for the treatment of gastric ulcers. PGS stimulate pancreatic secretion and increase the motility of the intestine, which may cause diarrhea. 6. Influence on the immune system. Macrophages secrete PGE2, which decreases the immunological functions of B and T lymphocytes. PGE2 inhibits the proliferation of both B and T lymphocytes as well as the conversion of B lymphocytes into plasma cells, is also inhibited. 7. Effects on respiratory system. All prostaglandins have powerful effects on both respiratory smooth muscle and pulmonary vascular smooth muscle. PGE is a bronchodilator, whereas PGF acts as a constrictor of bronchial smooth muscles. PGE and PGF oppose the actions of each other in the lungs. PGE1 and PGE2 are used in the treatment of asthma. Several studies suggest that endogenous PGE2 may be bronchoprotective in human asthma. It reduces the vagal cholinergic contraction of airway smooth muscle. 8. Influence on renal functions. PGE2 is a major determinant of renal vascular reactivity. It opposes the vasoconstrictor and natriuretic actions of PRASA or hormones, epinephrine, angiotensin, vasopressin, etc., and blocks the release of noradrenaline from adrenergic nerves. It increases the glomerular filtration rate and promotes urine output. The excretion of Na+ and K+ is also increased by PGE2. 9. Effects on metabolism. Prostaglandins influence certain metabolic reactions, through the mediation of CAMP. PGE decreases lipolysis, increases glycogen formation and promotes calcium mobilization. X. Platelet aggregation and thrombosis. The prostacyclins, PGI2, inhibit platelet aggregation and produce vasodilation. Prostaglandin E2 is also a vasodilator, while thromboxane A2, TXA2, promotes platelet aggregation, vasoconstriction, and blood coagulation that might lead to thrombosis. Clinical aspects. Prostaglandins are used in the treatment of gastric and duodenal ulcers damaged by acetyl salicylic acid, aspirin, and other nonsteroidal anti-inflammatory drugs, hypertension, thrombosis, asthma, etc. They are also employed in the medical termination of pregnancy, prevention of conception, induction of labor, etc. PGE analogues are also used to treat glaucoma. PGE1 is used to treat erectile dysfunction of the penis via penile injection or intraurethral routes. It is also used in babies with congenital heart defects, as a slow injection into a vein to open the ductus arteriosus until surgery can be carried out. 5.8.2 Thromboxanes, TXS, a group of prostaglandin-related icosanoids, derived mostly from arachidonic acid by cyclooxygenase pathway. They are prostanoid types of icosanoids. Thromboxanes have a 6-membered oxane ring. Thromboxane A2, TXA2, is the most important type of thromboxane that is produced by activated platelets during hemostasis and has prothrombotic properties. Following are the general functions of thromboxanes. Promote vasoconstriction. Facilitate platelet aggregation. Stimulate blood clot formation. Induce lymphocyte proliferation. Bronchoconstriction. Figure 5.29 Structure of thromboxanes. 5.8.3 Prostacyclin, it is also called prostaglandin I2, PGI2, contains another ring between the 6th and 9th carbon atoms. They are synthesized in the heart and vascular endothelial cells. They exhibit the following functions. Inhibit platelet and leukocyte aggregation. decrease T-cell proliferation, lymphocyte migration, and secretion of interleukins like IL-1 alpha and IL-2. Induce vasodilatation and production of CAMP. Prevent clot formation. Figure 5.30 Structure of prostacyclin. 5.8.4 Leukotrienes, LTS. These are one of the major constituents of a group of biologically active oxygenated fatty acids called icosanoids. Leukotrienes are derived from arachidonic acid by the lipoxygenase pathway. They are named after the word leukocyte, or white blood cell, owing to their synthesis and occurrence related to these cells, and from their characteristic 3 conjugated double bonds, trienes. They are so named because first seen in leukocytes. Different types of leukotrienes are recognized by the letters A, B, C, D and E with subscripts mentioning the number of double bonds in the respective leukotriene. LTC4, LTD4, and LTE4 are often called cysteine leukotrienes due to the presence of cysteine in their structure. The cysteine leukotrienes make up the slow-reacting substance of anaphylaxis, SRSA, because they prolong the contraction of smooth muscles during allergic reactions. Functions of leukotrienes. LTS facilitate chemotaxis, inflammation, and allergic reactions. The slow-reacting substance of anaphylaxis, SRSA, is a mixture of leukotrienes C4, D4, and E4. This mixture of leukotrienes is a potent constrictor of the bronchial airway musculature. LTS cause smooth muscle contraction and are as much as 1,000 times more potent than histamine in constricting the pulmonary airways. They enhance mucus secretion in the airways. They also increase capillary permeability, edema, increase fluids leakage from small blood vessels, and constrict the coronary arteries. They are important regulators in many diseases involving inflammatory or immediate hypersensitivity reactions such as asthma. LTB4 attracts neutrophils and eosinophils to the site of inflammation, chemotaxis. It also promotes neutrophil endothelial cell adhesion. 5.8.5 Lipoxins. These are one of the types of icosanoids, derived from arachidonic acid by the lipoxygenase pathway. They play a vital role in reducing excessive tissue injury and chronic inflammation. They regulate components of both the innate and adaptive immune systems including neutrophils, macrophages, T and B cells. Summary. Lipids are naturally occurring heterogeneous groups of compounds, insoluble in water, hydrophobic. A fatty acid is an organic acid that occurs in a natural triglyceride, and it is a monocarboxylic acid ranging in chain length from C4 to about 24 carbon atoms. Its general formula is RCOOH. Saturated fatty acids do not contain a double bond in their structure. Their general formula is CnH2n plus 1 COOH. Unsaturated fatty acids have one or more double bonds in their carbon chain. The systematic name for a fatty acid is derived from the name of its parent hydrocarbon by the substitution of OIC for the final E. The omega numbering system is the way to indicate the position of a double bond by counting from the distal end, with the omega carbon atom, the methyl carbon, as number 1. Essential fatty acids are polyunsaturated fatty acids that are not synthesized in the body and are necessary for normal growth and development. Names of the essential fatty acids are linoleic acid, linolenic acid and arachidonic acid. The values of melting points of the fatty acids are concerned with the chain length and the presence of many double bonds. The cis or transgeometric isomerism is found in the carbon chain where a double bond exists. In the case of the cis isomer, the groups attached to the carbons of the double bond are on the same side. If the two groups lie on opposite sides of the double bond, then the isomer is transform. The ester is an organic compound formed from an alcohol and an acid by splitting out a molecule of water. The water is formed from the H of the alcohol and O of the acid. Simple lipids are esters of fatty acids with alcohol. Phospholipids are composed of fatty acids, alcohol, and phosphoric acid. Glycerophospholipids are composed of glycerol, fatty acid, and phosphate group. they are also known as phosphoglycerides or glycerol phosphatides. Phosphatidylcholine, lecithin, is composed of fatty acid, glycerol, phosphate, and choline. Phosphatidylethanolamine, cephalin, is composed of fatty acid, glycerol, phosphate, and ethanolamine, nitrogenous base. Phosphatidylinositol is composed of fatty acid, glycerol, phosphate, and inositol, hexitol. Plasmalogen is phosphatidylcholine or phosphatidylethanolamine with a vinyl ether linkage on the first O group of glycerol. Phosphatidylglycerol is formed by the esterification of phosphatidic acid with glycerol. Structurally it is a diphosphatidylglycerol, known as cardiolipin. Phosphatidylserine is found effective in the treatment of Alzheimer's disease, age-related decline in mental function, attention deficit hyperactivity disorder and depression. Sphingophospholipid, sphingomyelins, are composed of fatty acid, phosphoric acid, nitrogenous base, and sphingosine. Ceramide is a sphingosine fatty acid complex. The normal range of lecithin/sphingomyelin, L/S, ratio is 1.5:1, which indicates adequate fetal lung maturity. Glycolipids, glycosphingolipids, are composed of sugar, fatty acid, and alcohol, usually sphingosine. Cerebrosides are ceramide monosaccharides, that contain either a molecule of galactose, galactocerebroside, or glucose, glucocerebroside. Gangliosides are sialic acid-containing glycosphingolipids, richly found in the gray matter of the brain. Lipoproteins are complex particles that have a central hydrophobic core of nonpolar lipids, primarily cholesterol esters and triacylglycerols. Types of lipoproteins are chylomicron, very low-density lipoprotein, VLDL, low-density lipoprotein, LDL, and high-density lipoprotein, HDL. HDL is involved in reverse cholesterol transport, i.e., takes up cholesterol from peripheral tissues and returns it to the liver as cholesterol esters, that's why it is termed good cholesterol. Apolipoproteins are the components of different lipoproteins found on their surface. Derived lipids are the hydrolytic products of simple and compound lipids. They include fatty acids, glycerol, steroids such as cholesterol and steroidal hormones, etc. A liposome is a spherical vesicle having at least one lipid bilayer with an enclosed part of the aqueous medium. Micelles are colloidal particles formed by aggregation of lipids in such a way that the polar region faces the outer surface of the micelle and the nonpolar region forms the central core. Saponification number is the milligrams of alkali, NaOH or KOH, required to neutralize 1 gram of fat is called saponification number. Iodine number is the number of grams of iodine taken up by 100 grams of fat and is termed as iodine number. It is an index of the degree of unsaturation of fat. The appearance of unpleasant taste and smell due to the deterioration of fats and oils is called rancidity. Steroids and sterols are the groups of naturally occurring substances having in common a steroid nucleus called per-hydroxychlopentanophenonthrene. Cholesterol is the most important sterol in the human body. It is a 27-carbon compound with a steroidal nucleus, having molecular formula, C27H45O. Cholesterol is the precursor of all other steroids in the body, including hormones of the adrenal cortex, sex hormones, bile acids, and vitamin D. Isoprene unit is 5 carbon atoms and 8 hydrogen atoms containing structure. Multiple isoprene units containing hydrocarbons are called terpenes. Icosanoids are a group of biologically active substances derived from 320-carbon polyunsaturated fatty acids, dehomogammalinolenic acid, arachidonic acid and icosapentanoic acid. Prostaglandins, PGS, are a group of icosanoids, derived mostly from arachidonic acid by the cyclooxygenase pathway. Prostaglandins are used in the treatment of gastric and duodenal ulcers damaged by acetylsalicylic acid, aspirin, and other nonsteroidal anti-inflammatory drugs, hypertension, thrombosis, asthma, etc. Thromboxanes, TXS, are a group of prostaglandin-related icosanoids, derived mostly from arachidonic acid by the cyclooxygenase pathway. Leukotrienes are the major constituents of a group of biologically active oxygenated fatty acids called icosanoids, derived from arachidonic acid by the lipoxygenase pathway. Leukotrienes facilitate chemotaxis, inflammation, and allergic reactions. References. Exercise questions. For MCQ 1 to 4, see Part 1 of 2 of this chapter. MCQ 5. Which of the following dietary lipids has the highest value of iodine number? Butter, corn oil, olive oil, palm oil, sunflower oil. MCQ 6. A 40-year-old man has central/abdominal obesity. Which of the following lipid profiles would he have? Upward arrow HDL, downward arrow LDL, downward arrow TGs. Upward arrow LDL, downward arrow HDL, upward arrow TGs. Upward arrow LDL, upward arrow HDL, downward arrow TGs. Downward arrow LDL, downward arrow HDL, downward arrow TGS. Upward arrow LDL, upward arrow HDL, upward arrow TGS. MCQ 7. A 64-year-old man suffering from hyperlipidemia consulted a cardiac OPD for a follow-up checkup. He was advised to check his lipoproteins levels. Which of the following lipoproteins is most likely reduced in this patient? Chylomicrons. High-density lipoprotein. Low-density lipoprotein. Very low-density lipoprotein. MCQ 8. A 56-year-old man is suffering from ischemic heart disease. Which of the following test would be most suitable to evaluate this condition? Serum AST, serum cholesterol, serum LDH, serum potassium, serum sodium. Please write answers in the comments. End of Part 2 of 2 of Chapter 5. Thank you.